Okay, page 94 under urinary tract infection. We're just going to continue there. Actually, we had got all the way down through the gastrointestinal system. I didn't put a highlighter on it, but I got it. We're going to come on, we're on page 95. We were looking at the system and what all those systems are involved, and the gastrointestinal system and all the digestive organs that are involved, breaking down food. Fluids and nutritious appealing meals should be encouraged. Remember, oral care should be provided. A lot of times in the nursing homes, they're not brushing teeth and brushing dentures and doing what they're supposed to do with those things. We're going to have to brush their teeth. Also, got to make sure that if they have dentures, we're going to put them on. If they want dentures, some people would take their dentures out and chew without the dentures. Just let them choose by what they're doing. They should eat a diet that contains fiber and drink plenty of fluids. Also, what we need to observe and report with the digestive system, any difficulty swallowing or chewing, tooth pain, any hurts in their mouth, any sores in their mouth, all that should be reported. Any fecal incontinence, that is the inability to control the bowels, leading to involuntary passage of stool. Underline that. So you can be urinary incontinent and fecal incontinent. So you know, that's on page 95, top of 95. You need to report weight gain, any loss of appetite, any abnormal pain, any diarrhea, nausea and vomiting, especially things that look like coffee grounds. What if somebody throws up coffee grounds and it looks like cold coffee grounds? What do you think that is?
I don't know. I never heard of it.
That is blood. Something in your body, all of your gastrointestinal juices and blood mixes together and it looks like coffee grounds. And I've seen that. It looks wet coffee grounds, like used coffee grounds.
And it's blood?
And it's blood.
Oh.
Yeah. Yep, so make sure if you ever see that, get them somewhere. That means they're bleeding in their stomach. Something's happened or blood is happening along their esophagus. Somewhere they're bleeding. And we need to get that checked. ASAP. Not a good sign. Any constipation, hiccups, belching, bloody, black, or hard stools, heartburn. And constipation is a terrible thing. It is the inability to eliminate stool. We already know that. Or it's also constipation, they call it, when it's infrequent, difficult, and often painful elimination. That is constipation also. How do we fix constipation? We increase our fiber and our fluid intake, increase activity, and possibly some medication. Some people take Colace every day. Some people take a diuretic type of, not diuretic, but diarrhea type medication to induce a little more fluids in their stream, in their urinary tracts. I mean, gastrointestinal tracts. Goodness. Sometimes it gets stuck in that place so bad that we're going to use an enema. An enema is a specific amount of water with or without an additive that is introduced into the colon. So y'all know what an enema is? You have to insert it inside into the anus, and sometimes it's made of oil, soap water, soap suds, enema. Really depends on what kind of enema you're using. But guess what's going to happen in about 15 minutes? If I give you an enema, or I give you a patient an enema, what's going to happen in 15 minutes? Nobody knows?
They got to use the bathroom?
Yes. And your best bet is to make sure you are ready. Because
That's the boo-boo.
boo-boo. And enema.
That's like a, what it is, the thing to stick up your booty?
Yeah, that's what we're talking about.
Oh, that's what it is?
That's what an enema is.
Oh. Oh, you say something else.
An enema is a specific amount of water with or without an additive that's introduced into the colon to eliminate stool.
It makes you go when,
Yes. Or it can be a suppository, which is kind of looks like a wax bullet to me.
I think that's what she used to call it.
Yeah, that's what I do. Used to have to get one when I switched her from
Oh
fresh
yeah,
milk
they'll
to,
mess them up. They'll give them little suppositories, and it help them a whole lot. And just know that those two things are to help for constipation. Fecal impaction. That's when they haven't used the bathroom in a while. Normally at least every 3 days. If not, we are going probably to go in there. If you've ever felt a hard stool inside someone's stomach, you will know exactly that that's what it is. And you go in there with your digitals, and probably a nurse will do this. Some nursing homes want the CNAs to do it, but most of the time it's your nurse.
Will we learn that? How to do that?
They will show you how to do it. If they expect you to do it, they're going to have to show you how to do it.
What you do?
talking about here. We learn how to do that here.
You just lube your hands up really well, put you some gloves on, and go in there
Oh.
and dig it out.
Is that good?
And a little, yes, ma'am.
I'm good. I'm like this.
But you got to remember, you're trying to save their life because a fecal impaction can cause them to die. Because what it does is cause all the blood to, just like a clot in the brain. It's a clot in your colon, and it causes things to start dying. And that's, I don't like it either. Who likes that?
So you're not doing.
But yeah, but
It wasn't too bad.
you're going no,
Is
nowhere
it like
near that.
hard or is it?
Most time, yeah, it's hard.
Okay.
Yeah, and we just get that on out of there and have your little bath basin or whatever, cloth, whatever you got, and then just put it right there on the thing until you feel that they
It's
can.
more than one of them. If you like.
Sometimes it's bally, sometimes it's just a big knot, but you're gonna want to get it out because
You can feel it in the
they will feel so relieved. They're gonna not like you in their rectum, but they're gonna feel so much more relieved because you have helped them.
You can feel it in the stomach.
Yeah, most of the time you can feel it like right over here on this side.
So what they do, make them bend over and.
No, they'll be laying down, just like the doctor come at you, or on their side. That's the way I did it, on the side. Hemorrhoids are very similar, not at all. Hemorrhoids, what they are enlarged veins in the rectum. They may be also outside the anus. Those is like your anal parts, I'm gonna say parts, have came out a little bit. Not so much all the way, but that's why they call them hemorrhoids. They're very, very venous, or they can bleed really easy. So you gotta be very careful with them. Yep, and it happens, especially childbirth. If you push too hard, they tell you to push with everything you got, and people do. And I've actually seen it come out, and the doctor just quickly put them back in, because if you let them swell at all, any outside the body, you won't get them back in. So he kind of just pushed them back in. It was just like fleshy meat came
So
out. Kind of like it turned upside down a little bit.
it won't turn upside down
Like if some of that part comes
like.
out.
So it do look like, I don't know.
It's just fleshy.
I'm gonna go
Fleshy. That's about it.
with it.
Most of the time it's just a little part that's out and irritates the mess out of people. And they will actually cut that out and have hernia surgery. I mean, hemorrhoid surgery. Diarrhea. Y'all know what diarrhea is? It's a frequent elimination of liquid or semi-liquid feces. And that's exactly what it is. But what I want y'all to know is that last sentence. A diet of bananas, rice, applesauce, and toast. It's prescribed for a short term when they have diarrhea. So a Brant diet: bananas, rice, applesauce, and toast. So if they tell you this person is a Jehovah Witness and they have had diarrhea for 3 days and they hate vegetables, what would you include on their meal tray?
No, rice and toast.
They have like vegetables, that's a fruit.
Yeah, any of that. Any bananas, rice, applesauce, or toast.
Oh,
Yeah.
what the heck I'm thinking.
Yeah, you want all of that. That's what they're going to give them, all of that. And it's probably going to be that. But don't choose like steak and potatoes, fruits, or that's not what you want. They need bananas, rice, applesauce, and toast.
Applesauce and toast.
Yes. Okay.
I'll still be hungry.
Are you gonna be at our clinicals with us?
Yeah. Yeah.
Oh, so you did?
Gastroesophageal reflux disease, or the GERD, is commonly referred to as GERD, G-E-R-D, a chronic condition in which the liquid contents of the stomach back up into the esophagus. Have you ever had heartburn?
Yeah.
Very much the same thing. GERD is kind of more of the chronic
So
nature.
Is this acid reflux? Is that what this is?
Yeah, pretty much. When they start want to call it GERD is when you have it all the time. Heartburn is when it comes on occasion, pretty much. Heartburn is the most common symptom of GERD. Heartburn and GERD must be reported to the nurse. How are we going to help this? As a CNA, what are we going to do? We're not going to allow our patients to lay down after how many hours?
Give us some milk.
You're not going to let your patient lay down for 2 to 3 hours after they eat. If you lay a patient down that fast after they ate, then they're going to get heartburn. That's just going to happen because the body's working at your stomach's doing its thing. It's churning up all the foods, and it's working. So it's gonna throw some back up. So that's why we need to sit up.
You say do it babies when they have reflux. You can't lay them down after you feed them.
Yeah, you're not supposed to sit them up. The babies get reflux too. Babies get reflux too.
Oh yeah, I know.
Yeah.
Bad.
Yeah, and they'll be crying. You don't have no clue what's wrong with them.
Sometimes they be gay, and then they.
You gotta watch out your babies too, but especially your elderly people also. Serving the largest meal of the day at lunchtime. Serving small meals throughout the day and reduces fast foods, fatty foods, and spicy might help GERD. So when are we gonna eat the largest meal of the day for a GERD patient? At lunch. Okay. Also, stop smoking, not drinking alcohol. They say that causes GERD also. An ostomy is a surgical creation of an opening from an area inside of the body to the outside. Underline that. Know what an ostomy is, because there are different types of ostomy. In this chapter, this section, we're going to talk about a gastrostomy. That is with your stomach.
Yeah, people go and have gastro surgery where they get that stuff, that fat sucked out of them.
Lipo.
Yes, lipo.
Ah, the opening is called a stoma. Underline that. The opening that they make inside the stomach, or it could be your urinary bladder. They make a urinary catheter also, urostomy. But the hole is called a stoma, and we will actually clean that stoma. If they have that chance, you'll clean the stoma. So the terms colostomy and ileostomy tell what part of the intestine was removed in the top of stool that were eliminated. So we know that the ileostomy, or the ileum, is part of the small intestine, right?
Yeah.
Your small intestine comes first. You got your duodenum, your ileum. Oh, and there's another one. I done forgot. I forgot the other one. But the ileostomy is the small intestine. So the colonostomy is in the large intestine. So tell me, which one do you think would be more liquidy?
The ileostomy.
Ileostomy, right? Because how your digestive system works. We're just a big old sewer system. Our whole body is. I don't know why people don't think so, but we really are. What water we drink gets recycled. It goes in our blood. We use it. It goes through our digestive system. Our digestive system soaks it right back up, all the way through your colon. And that's what it does, all the way through your colon. That's why in the ileostomy, it's going to be thin and watery, more thin and watery. And as it goes down your colon, which is it's making your bowel movement, it pulls all the water back out, because it needs the water back. We need water, so it's pulling it back, and that makes your bowel movement harder as it goes down. So when we get all our stuff back, all our water back from the colon, then we have, at the end, it makes a bowel movement. So by the time it gets to the colon, it's going to be a lot more solid than it is at the ileostomy. Many people manage the ostomy appliance by themselves, and you would be amazed at how many people have colostomies and you'll never know it.
Have what?
Colostomy. That is the one that actually comes from the colon.
So people, wait, I'm confused about the colostomy, whatever I'm trying to say.
You got the ileostomy is a little higher than the colostomy.
It's a hole
It is a hole
on the outside of your skin.
on the outside of your skin.
So
The picture, you barely can't see it, but look at figure
oh, I see it.
423. That's a nice representation
So
of the
people's
hole that
bowel
comes
movement
out.
come out of that hole.
Yes.
Oh my god.
Oh, wait, no.
The hole on the stomach on figure
Oh,
423.
yeah, I know somebody who was like that.
Yeah.
I don't.
And that's what we do. Look on figure 422. Those are your ostomy drainage bags. Okay? And sometimes we have to change them. Normally the nurse will do the bottom half, the part with the little bitty hole, because we've actually got to cut that hole the size of that stoma. See the size of that man's stoma in 423? We will cut a hole into that big, set it over. Set it over his stoma. Stoma doesn't move. And then we cut the hole the correct size and put that bag. It just comes out. Just like our body is working on our stuff right now. So when it passes that section, it's gonna, instead of going through his bowels, it's going out the bag.
So when you change it, it don't just come out sometimes?
Yeah, sometimes they do. You have to put a napkin or a paper towel, toilet paper, whatever, and line it. While you're cleaning it, it may still seep out. Just don't be cleaning it right after they eat. You know what I'm saying?
Wait about a couple hours
Yeah.
after you done sucked it
Yeah,
out.
because you know our bodies are working. Every time we eat, it's working. So,
I can feel it right out, especially drinking milk. Oh my.
Oh, yes,
It's like my
yes.
stomach can turn if I drink milk.
yeah. So let their stomach die down from digestion and do it all that working, and then change it. But that is what I want you to look at. Then we attach that bag, and then we actually drain that bag into the toilet, wash it out. Sometimes we have to wash it out, put it right back on. Sometimes we can change and put a new one. It depends on the people. If they have money like that. In a hospital, you might better just change it.
Because there's so many there.
Yeah. And people's homes, they're very expensive.
If I was in the hospital, I'd take the things home.
Oh, I try to take it.
Boy,
As much stuff as
I wouldn't do nothing like that. Page 97, number 10 though. That's what I do want you to look at. If you can, use disposable wipes, so you can just throw them away and flush them. If not, use some toilet paper. Number 10, using a washcloth or warm soapy water, wash the area in one direction away from the stomach. Underline that. One direction away from the stomach, just like it's the sun and you're wiping away. Right. Or you can start in the center and go around, as long as you go around and out. As long as it's away.
So you walk the inside of it?
No, well, yeah, you tap on the top of it. It's just like cleaning your bottom.
But what's the purpose of cleaning if boo come out sometimes clean?
Just so it will not catch infection. You don't want.
E. coli.
It's just like fecal matter. When you use the bathroom, what do you do with it?
Wipe.
You wipe it off and it goes into the trash.
Yeah, but I'm saying like if it's
You don't
still
want it to
coming
sit
out,
on top of you.
I'm saying like if you change it, if you going to wash it, and it's coming out. While you trying to wash it, just let it come out and then wait till after it's done and then wash it.
Maybe it'll probably just leak a little bit. It won't be like that.
Oh, okay.
Yeah, you'll have a chance, and you'll probably see it and be like, oh, let me hurry up and wash because I see it leaking out. Or you will catch it, but it's not bad as people think. Yeah, and it's actually I like doing the bags a lot better, and stomas a lot better than you're having to change. It's a lot more physical labor involved in changing a brief.
Whole pamper.
Yeah, you take your clothes off, put the clothes back on, you change your brief, and
I think I'd rather do bedpans.
or you can do your colostomy.
Just lift on up.
Yeah, now if they can do that, that's a wonderful thing.
But see, it's
Sometimes they're incontinent,
bedpan.
so that is not a good
So
thing.
we haven't seen it with boo or pee in it.
No. But
That's
the
a
people
whole-
with big heavy set people, what do they have?
Same things. It's the
They
same
baby-
thing.
So are they able to lift themselves or you gotta have help?
It depends on the person. Some big people are limber than you,
No, I'm talking about
and
like
then if they are
400
that
people.
person, I'm telling you, they
You have help though. You just say, can somebody
Yeah,
help
if they can't lift themselves, you're gonna find you some help.
Okay.
Yeah, and a lot of times there's a machine. They might use the lifting machine for that. So I don't want y'all using the lift machine. You can set them up. You can put them on their strap. You can do all that, but you cannot push that button. But you can set them up. You can get them ready.
Push what up to lift them up.
Like if somebody needs some help and you know that the CNA needs help, y'all are gonna experience this. So let me tell you, in the nursing home, somebody might need to use the bathroom, but you cannot lift that Hoya lift, and you already know that. But you can set this patient up. If your CNA says, "I'll be there in a minute," you can set them and get them ready. So when they get there, that they can pick that patient up with the machine. But you cannot operate it.
I'm nervous. I gotta get me some shoes. Make sure I'm broke.
Yeah, you got to do all that.
Dang.
And believe it or not, y'all had 3 days. Most people don't have but 2. But we're gonna even go over it again tomorrow.
Tomorrow's our last day. Then we just throw them to the wolves.
No, that's your last day. You still
We still on
I know we still got.
Yeah, I need y'all to come back on Thursday too. Y'all can do Thursday.
Tomorrow? I mean, this week, Thursday?
Mhm.
Yeah.
Thursday.
But Friday I can't because I'm going to the
Oh, I
party.
can't. Wait, what time? Well, I might be up.
What you got to do?
All right, let's get on to 8, and once we get through with this, I'm gonna give y'all a break, and we're gonna keep going. Okay? Because we're not. We're almost done. Y'all think about that. Number 8, page 98. The endocrine system. We done talked about the endocrine system a little bit with your diabetes, yes. Glands are organs that produce and secrete things called hormones, which them hormones are called insulin. And a lot of other things that they secrete. That maintains homeostasis. It influences growth and development. It regulates sugar, regulates calcium, the body's to produce. All of this is hormones. And also determines how fast cells burn food for energy. Normal changes, you need to know. Levels of hormones such as estrogen and progesterone decrease. Underline that.
What does that mean? Estrogen and
Those are types of hormones that we use.
for what?
Those are female hormones.
Like what?
For especially when it regulates your period. Insulin production lessens. Body is less able to handle stress. How you can help? Number 1, try to not to stress an older person. You're going to aggravate them to death. And it messes with their insulin, and not insulin, but their whole hormonal system. What you need to report is headache, weakness, blurred vision, dizziness, irritability, sweating, changing normal behavior, confusion, changing mobility, changing sensation, numbness, tingling in the arms, weight gain, loss of appetite, increased thirst. We're talking about our hormones. What would that mean? Increased thirst?
High blood sugar.
High blood sugar. Frequent urination or change in urine, hunger, dry skin, skin breakdown, sweet or fruity breath. What might that mean?
Sugar.
High blood sugar. If it's real high, it'll get all sweet.
Yeah.
Sluggish, fatigue, or hyperactivity. So we already know a little bit about diabetes. Underlying the insulin is the hormone that is secreted.
Turns sugar into energy.
Insulin is a hormone that converts glucose or natural sugar into energy for the body. So just know that is what insulin does.
Your body is full of
We need insulin, but not we do. You don't need a lot of sugar. Yeah, we have to have sugar.
You have to have sugar. You have to have insulin to survive. If you don't have that,
Some people are born without insulin. Those are our type 1 diabetes. Underline type 1.
The worst there is.
And that third sentence is they do not produce any insulin. Type 2,
The best one.
they do not produce enough insulin or the body fails to produce insulin.
Or don't produce it.
I seem to think that God gave you so much insulin that once you use it all, it's gone. So once you have ate up all the candy while you was young, and you, especially when you get it older,
I didn't eat candy growing up as a kid.
potatoes and breads and congenital. Am I saying that right?
Hereditary.
Yes, or congenital.
But see, I'm the only one in my family with it. Nobody else had it but me.
You ate too much sugar. Pizzas and potatoes and bread.
That's how my mom used to feed us.
Right.
Pizzas, noodles, cereal.
You don't use all your insulin up. I always say that because I have low blood sugar, so I really think my insulin worked too much. So eventually, I think I will not have enough insulin. Not so much. I feel it when it goes real low because I run at 60.
No, not me. I'm at 60.
Yeah.
I'm shaky.
Yeah, and most people will be. I get shaky at 50.
But I've been walking around with a 26.
I've walked with a 40, but 26 is bad.
Perfectly
Your
fine.
brain is losing cells.
And my blood sugar is normally, it runs between the 400 or 500 all the time.
Yeah, you got to get off of that because it's going to mess with your kidneys.
Yeah. I drink a lot of water now. That's the only
If
reason
it's steady
why.
running 4 to 5, you need some insulin.
I take my insulin, but it's just like my body just runs high.
No, ma'am. You cannot let it run
But I
high.
don't eat right.
You hear me? You can't let it run high because every time it's above 120, it causes damage to your very small veins in your body. What? The result of that is dialysis when you get older.
Dialysis, amputations,
All
heart
of it.
problems,
I'm
kidney
trying to tell you.
problems, diabetes.
So if it says 400, you say, oh shit.
I do.
And you go get you some
I don't
insulin.
check it
But
anymore. I don't even want to
you gotta check it. And you gotta figure out what causes you to go so high and what keeps you going.
I work from 11.
Let's digress, or let's progress, I should say. So pre-diabetes, Occurs when a person's blood glucose levels are above normal but not high enough for a diagnosis. So, what is a normal blood pressure? Blood sugar,
120.
80 to 120.
80 to 120.
If you're running that, you're running good.
8120 blood sugar.
80 to 120. Sometimes you get gestational diabetes. That's what diabetes when you're pregnant. And my baby gets there, and that's why she's at the ER right now. She's got 300, and she went down to 47 the other
Oh
day.
yeah, that's when they give you that stuff.
And she was supposed to be tested for the sugar stuff too. I don't know if she's done that yet, but it's messing her up this time. She needs to stop.
It's the extra when you
Don't have another baby. That's 4 years, 4 babies.
Pregnancy
Are you
hormones
talking
and diabetes don't mix. I was in the hospital for 2 weeks. They couldn't control
No,
my
not at the
sugar.
same time throughout her years, but this is her 4th.
Yeah, that's what I'm saying. Her fourth time.
Yes. People with diabetes may have signs and symptoms: excessive thirst, extreme hunger, weight loss, high blood sugar levels, blood sugar in the urine, sudden vision changes, tingling, numbness in the hands or feet, very tired much of the time, dry skin, sores that slow to heal, more infections than normal. That's why we watch out for our diabetic patients.
Always wear shoes.
Always, they don't want them to hurt. They really worried about them feet because there's so many not bad, but very, very little bitty veins
And
in
when you
your
can't
feet.
get pedicures if you're diabetic.
Yep, they don't want you to do none of that.
No.
Go to the podiatrist and tell them to paint your feet. No, I'm just kidding. Page 100, that first paragraph. Poor circulation and impaired wound healing may cause leg and foot ulcers, infected
Gangrene.
wounds, and gangrene. Gangrene can lead to amputation. That is very important. That's our number one reason why we're always watching our patients. You got to watch them feet. For guidelines for diabetic patients, follow the diet instructions exactly. They need to have a balanced meal, but less carbohydrates, less concentrated sugars. Encourage them to follow their exercise program because exercise can also break down the sugar in your body. Observe the residents' management of insulin. Make sure they know what they're doing when they're putting in the insulin. And if they are giving themselves insulin, or we give them insulin, make sure that they're going to eat something behind it. Or if their blood sugar is already high, that we're going to monitor again and make sure it went down. You do not just leave it. Yeah. If you look at that figure 425, that is a glucose monitor machine, or they call it glucometer. That's the little thing beside it, that's blue, that is a lancet. You take that, you pop a little hole in your skin, you take that first drop and you actually wipe the first drop away, and then you test that second drop. That's going to be your accurate blood reading for your glucometer. And sometimes they let the CNAs do that. It depends. They're going to teach you how to do it. It's not a hard thing, but you're going to have to be certified. They're going to have to certify you some kind of way by writing on a piece of paper that you have been trained to do
Like
it.
pricky finger.
Yeah,
Wipe
and
the
then,
first blood, like when you finna give blood at the,
yeah, wipe that first blood. They're going to test your iron level. That's when they test that iron level.
Oh yeah.
So we are daily inspecting their feet, everything about them. When we're rolling them, when we are changing positions, how often do we change positions?
every 2 hours.
Every 2 hours. We're looking at their body. We're looking for any kind of anything. If they're walking, we're watching their feet. My lady, she had sore going on, didn't even feel it. Didn't even know it was there. Because diabetic neuropathy is real. They get to not feeling themselves, or they're very sensitive. Either or, but sometimes they just don't even feel. They can have a nail stuck in their foot and don't even know it. Describe the reproductive system. Y'all know about the reproductive system, right? What does the reproductive system do?
Baby.
It helps you reproduce. What are the sex glands called? We're all talking about the glands still. We're on the in our
What is that? Gonal?
gonad.
Gonal.
Y'all never heard of gonads?
No.
That's the sex glands. That's what happens. That's what you need to make
Men
sex
have gonads.
happen. They have gonads. Women have gonads. It's just the sex parts of the body. Okay. Normal change of agent. Underline. Prostate gland enlarges, which can interfere with urination. That is normal.
What is that?
Right up under the man or the woman right there.
Oh.
Prostate gland enlarges, which causes interference with urination.
What's the
And what they would do, it's a structure that is beside their urethra, and as they age, that structure gets bigger and occludes the urethra a little bit, sometimes a lot. And it depends. Some people actually have to go get medicine to shrink it back down. They call it benign prostatic hypertrophy. But it is normal in aging. A guy, when he stands in front of the toilet bowl and looks at it and says, I got to urinate, I know I do, and then he got to think about it a little longer. That probably might be a sign of it getting larger. But as they age, it's going to get larger. That is a normal change of aging, okay? Normal change for a female. Menstruation ends, we know that one. A decrease in estrogen may lead to a loss of calcium. This can cause brittle bones and potentially osteoporosis. Underline that. So what causes osteoporosis?
Change of female age.
A normal change, a decrease in estrogen.
Oh,
I can tell y'all ain't nowhere near getting old. Because we know all about estrogen the older you get. A decrease in estrogen leads to a loss of calcium. Somehow they play a role together and holds on to the calcium. That's why bones become weaker as you get older. That's why after menopause, you're going to be taking calcium supplements most of the time. How the NA can help. Make sure that you know that women's sexual needs and men's do not die with age. A lot of times they may get all comfortable with themselves the older they get. Who knows? But just respect their rights, whatever they might be. If they're girl, boy, respect that too. Yes, they got. I do know. I've seen one in Moultrie, a girl, 2 ladies, partners. They actually got married in another state, so they're married, but they're together at.
And they both in nursing home.
In the nursing home. Yeah. Well, assisted living. They're in assisted living. Yeah. So it happens, but respect that, and just know that you may see things like that. You make sure that they're okay. You ask them, "Are you okay, Mr. Harry and Mrs. Lucy? Are you okay?" Yes. Leave them alone. And if you have to report something like that, then report it, because some facilities do not allow that. But that does not mean that you're gonna say that's not their right. But let somebody know, because sometimes it's just need to know information, not that they're going to do anything to them. Observe and report for the reproductive system. Any difficulty urinating, any discharge, swelling, blood, any breast changes, size, shape, lumps, or discharge from a nipple. What might that be?
Pregnant.
Yeah, you right about that. Or you right about that. It might be cancer.
If it's like discharge,
Yeah.
I'm thinking milk.
Yeah, it may be. They also may
Yeah, we
be
gotta understand
for the lumps.
pregnant woman.
That's why
Sores or
I-
genitals, redness, rash on the genitals, genital itching. If they report erectile dysfunction or painful intercourse, all that may happen and needs reporting.
What can hurt me?
Vaginitis is an infection of the vagina. It may be caused by bacteria, protozoa, or fungus. It also may be caused by hormonal changes after menopause. Most of the time, they're just going to give you an antibiotic and send you about your way, because that's just something happens at times, and you catch an infection, because bacteria is bacteria. That's what it does. But that's not sexually transmitted.
Do they have people with herpes in the nursing home?
Yeah, they got to get old too.
I mean, I know, but I thought
A lot of times that I have noticed that even though they have herpes simplex virus, their virus does not come out on them as much. You know, like an younger person, you can see it
they
bad.
look bad.
And I think as they age, it doesn't come out on them. Because I haven't seen a lot. Actually, I haven't.
Like people like AIDS and stuff, they
You
be on
get
their own
everybody and
side.
everything.
They'll be on their own side of the nursing home.
Most of the time, no. You're discriminating. You're just going to learn to treat everybody like they have
Like,
something.
at AIDS
What do we
side
call that?
hospital?
Sometimes, but not really.
I don't know.
What do they call using gloves and treating everybody like they have something?
It start with an A, don't it?
Standard precautions.
Yeah, no, my bad.
That's what we use.
I was thinking advanced because some A,
I have no idea.
I don't know.
But standard precautions is gloves
It's something.
and washing your hands every time you think you're going to touch some bodily fluids. Wearing your protective equipment is transmission-based precautions. So you got your standard, that's your gloves and your washing hands. Your transmission is adding the mask, the gown, whatever you might have to add just in case for transmission-based. So, benign prostatic hypertrophy, we've already talked about that. The prostate gets larger. This causes pressure on the urethra. Pressure leads to frequent urination, dribbling, or difficulty in starting the flow of urine. And that's what I've noticed them standing there. Residents' rights, sexual expression and privacy. Residents have the right to sexual freedom and expression. Residents have the right to privacy and the right to meet their sexual needs. That is their right. Okay? Describe the immune and lymphatic systems and related conditions. So what is non-specific immunity? It protects the body from the disease in general. That's just your normal things that we learned in high school, not even high school, elementary school. The little cells that we made and the little things that your white blood cells are going around eating all the bad stuff.
Yeah.
That's normal. But we also have specific immunity, what protects against a particular disease. And those are your antibodies. You got your white blood cells that's eating up everything. Your antibodies are actually going to find a certain something that it is immune to, that you have been exposed, you made it your antibodies, and it's going to go fight that. So that is your immunity. The lymphatic system removes excess fluids and waste from the body. It's kind of like your circulatory system, but it lies along with it. It takes out the trash out your body. So you need your lymphatic fluids drained. Or I should say not drained. Fluids. It's a good thing.
Let's say is it true that a breastfeeding mother can produce antibodies in her breast milk and it help the baby fight off the stuff?
No, well, yes. You have antibodies in breast milk. That's why it's the best thing to breastfeed. At least, I want to say 3 months, they say is.
I did it for a month. I had to stop. My decision got infected.
Well, that's fine. You did wonderful, because a lot of people don't even get that.
What kind
And you gave them those
My
antibodies.
decision, but the cover had got infected, and I was on some medicine. I had an emergency C-section because it was too much stress for her. But the medicine that I was on, I couldn't take it and breastfeed on, and I didn't pump and dump, so it just dried up.
Yeah.
I didn't have to do no cabbage like most.
Yeah, I've done some of everything. Mine. Normal change of aging for your lymphatic system is your immune system weakens, increases the risk of all types of infection. Underline that. We have to remember that with our old people. You do not play with them. Don't give them infections. Don't go around them if you're sick. Just don't. Also, remember right above the man body, responses to vaccines decrease. And you see at the picture, yes, all that kind of stuff. You see the picture where it says all them lymph nodes, they're everywhere. And so is your lymph system. So we need to drink our water. We're going to keep that system clean too. They're the ones helping us fight infection. They've got all that going on in there. What we want to observe and report for the lymphatic system is recurrent infections, such as fevers, diarrhea, swelling of your lymph nodes, and increased fatigue. All of that can cause you to get sick. Then we got our HIV and AIDS. Acquired immune deficiency syndrome is a disease caused by the human immunodeficiency virus, HIV. So HIV attacks the body, and when it gets into its last stages, it kind of reminds you of cancer. How cancer eats at its own self, that's how AIDS produces itself. We talked about this a little bit yesterday. HIV is a sexually transmitted disease that also can be spread by blood, from infected needles, or to a fetus from its mother. Underline that. Just that second sentence, second paragraph on 103. In general, HIV affects the body in stages. At first stage, it's like the flu, fever, muscle aches, you get a cough, fatigue. Then it moves on. These are signs of the immune system fighting the infection. As it worsens, the immune system overreacts. It acts not only to the virus, but also to your normal tissues. That's another reason. Your HIV people, you need to protect them. Don't be coming around them sick. They already don't have a good immune system. You don't need to give them any infections either, because they are very susceptible. Come on down. They will not call it, the diagnosis of AIDS is not made until the CD4 count is 200 or below. So underline that. And
What's
they will,
the CD4 count?
CD4, that is a type of white blood cell that runs in your body. And those, when they go way down like that, that means you got no system to fight. Your immune system is low.
Any little thing can catch you.
Yes. Any little thing can get them. That's why they even will not give them raw fruit because of the bacteria that could be on the outside of a raw fruit. Yes. The signs and symptoms of HIV infection and AIDS: flu-like symptoms, appetite, weight loss, night sweat, swollen lymph nodes, severe diarrhea, dry cough, skin rashes, painful white spots in the mouth, cold sores, fever blisters, cauliflower-like warts on the skin and in the mouth, inflamed bleeding gums, bruising that don't go away, low resistance to infections such as pneumonia.
That's the number one.
Yes, that's the number one cause of their death. But also tuberculosis, herpes, bacterial infections, and hepatitis.
What if they already have it?
And if it breaks out, it breaks out. And it's going to break out with no holds barred because your immune system's not going to fight it. Kaposi sarcoma, a form of skin cancer that appears as purple or red skin lesions. They look like little dots, like they've been dotted. Red, little purplish dots.
Does it look like chickenpox?
Not quite like that, not so much a sore. Looks more like reddish, purplish dots, freckles. It kind of starts like that, and it's skin cancer. What it is. Pneumocystis pneumonia, lung infection. That's another name. That's what they call it every time they die. They died of pneumonia, and that's what happens to a lot of our AIDS patients. Or they may have made it through all those infections and made it on, and then they get the AIDS dementia complex. That's when it starts messing with their brain. A lot of times they don't even get there. They die of some kind of infection. They die of pneumonia before it even messes with their brain. Yeah. And those are the saddest ones because then they start really messing up. They can't start messing with their brain, and they can't think. Then they start having changes in their personality. Next thing you know, no personality. Then it starts where they can't walk. They can't function. They don't remember. It's kind of like they will go backwards.
Like almost like how Alzheimer's.
Kind of like that. It's just their body's actually eating itself. Alzheimer's, you're not going to see it so much. But AIDS, you're going to see the bodily condition.
So how
How do you know you have that?
Yeah. You take your AIDS test. There's no cure for this disease, and there's no vaccine to prevent the disease. People who are infected with HIV are treated with drugs and to slow the progress of the disease. If you need to get treated, because if you've ever been exposed and you're not showing signs and symptoms, there's some good medication out there that will make you live forever. And I don't mean literally forever, but a lot longer than it used to be. It used to be you got 8 to 10 years, maybe. And that's a maybe. You might got 2 years depending on the strain of the AIDS. That's just how it works. But now people are living and living and living. Yes, we got, and it's because it's hard to treat because it's actually a virus, and viruses are very hard to treat. We can treat bacteria. A virus is a whole lot. It's a different ball game. That's just like any virus. We got to catch the chain that makes the infection and try to mess that chain up. And AIDS keeps changing. That's why they can't just pinpoint it. Yeah.
People come up with more and more illnesses and disease every day.
A combination of medications can help people with HIV live longer. What we need to do. People with poor immune systems are more sensitive to infections. They may have a different type. They may have cancer, and you would treat them the same as we are treating our HIV patients. So the same thing we're trying
So you
to
can't
not
catch cancer.
let them get messed up. Yes, and you can't catch HIV unless you have sex with them. You gonna have sex with your patient?
What is like okay?
Unless it's blood.
Or blood or bodily fluids.
I got a question.
Yes.
Like,
I'm
okay,
just
let's
messing with
say
it again.
Let's say I had HIV and I stuck on my baby pacifier and into her. Will she get it like that?
They say no because once it hits the air, it dies.
I'm just wondering.
Involuntary weight loss occurs in almost all people who develop AIDS. High protein, high calorie, and high nutrient meals. And that's what's happening now. We can't even tell people. It used to be they get all skinny and I'll never forget, I lost about 50 pounds one time and somebody told me I had AIDS.
Really?
And I was on crack. I said, but
They love saying,
all that. I just lost some weight, man. And it hurt my feelings because I worked hard at losing that weight. And you can blame it on some AIDS and crack.
You must be on
And
AIDS.
I was mad. But she didn't know me.
Saying stuff like that though. They don't mean harm, but they be like,
She was a preacher. I think she came to save me. She told me God told her that. I said, no, baby, I think that's the devil talking to you. And if you don't get off of my front porch.
I would have told her the same thing.
She came to my house to save me. But yeah. But nowadays with medications, you don't see that as much. You don't see the weight loss. Their appetite will start going down. They start not eating as well. They may have infections in their mouth, so we need to give them soft foods, pureed foods. This is at the end. They've made it through a lot. This is when the body starts turning back on itself. They may have nausea and vomiting. We're going to have small, frequent meals, just like anybody with nausea and vomiting. Or they're going to give them a clear diet. So if they do vomit, then it's not so bad. And then give them nutritional supplements. A lot of times we'll give them Boost. That has all those nutrients in the drink. If they have mild diarrhea, we already know this. We learned this earlier. What kind of diet are we going to put them on?
Brat.
The brat diet. Bananas, rice, toast. There you go. Also, they want you to keep them rehydrated or hydrated after they've had diarrhea, throwing up, all that. Water, juice, caffeinated free soda, chicken broth. Caffeinated drinks should be avoided. They are diuretic. Caffeine is actually a diuretic. Make sure you use the restroom. Numbness, tingling, and pain in the feet and legs is usually treated with medications. Wearing a loose, soft slippers may be helpful. If they have real bad pain, you see that? It's called a bed cradle.
What that is?
That, all it does is pick up the covers off that person's lower legs. They seem to get a very high sensitivity to pain in their lower legs. So even covers sitting on their legs hurt them. So they will put them in a bed cradle. Give emotional support as well as physical care. They didn't ask for that. Just like you go out and find a boyfriend and you trust him and y'all ain't had sex, then y'all decide to have this lovely, we've been together 6 months, let's have sex. Next 6 months you find out you got HIV.
Oh my God.
Then that's why it's hard to trust that. I just feel sorry for everybody out there. But my goal to that is wear condoms. I don't know who was, and always everybody tells me I do use condoms. Yes, I do. I said okay, but didn't yesterday you tell me you might be pregnant? How could you have gotten pregnant?
Every time we
You're not using condoms.
Just to get that condom, just go. But I can't be like that these days.
Mine is, if I'm doing something like that, it is put the condom on. That is part of it. I work at night.
So married, you don't wear condoms?
No, I don't know what he do when he's away from me. I see too many married people having sex. No.
Yeah, you're right, but I'm saying.
I don't trust nothing. I don't care. I trust him, but I really don't. Not, he acts right, does right, and all the above.
Oh, they can still be.
Yeah.
Why would you have a baby?
Because I've seen it. I know one right now. He's best husband.
And still cheat.
I
know something like that. I don't know.
That's how my daddy.
You'll be surprised. You'll think somebody got the perfect marriage.
Yep.
But
that's how this happens, and people fall in love. They don't mean to be you're falling in love.
And
Some
they
people
never
don't care whether they got somebody.
especially if they have a baby on you. Like they have a baby on you.
Oh yeah.
So you really been, I know you've been,
And not using rubber.
Yes, that's what I'm saying.
You have risked my life to go out there and be with somebody. I don't believe in that.
That's what I mean.
No, I don't believe in that. You just make me mad. Withdrawal, avoidance of tasks, and mental slowness are early symptoms of HIV infection. Medication may also cause side effects. Then they start having that dementia complex. Now their mental systems, here it comes, and they start losing their mind. The facts about HIV: a handshake, a hug cannot spread it. You can get it by doorknobs, tables, chairs, toilets, mosquitoes, or by breathing the same air. So treat those people gently. They did not mean to go out there. Didn't nobody say, can I have AIDS? They might have went out there and said, can I have fun tonight, and made a bad decision. Or they don't even care about that decision they made. They still didn't ask for AIDS. And just remember that. People didn't ask for that. Yeah, even if, and I can't imagine, the first time I went to have my AIDS test, I was actually scared. I said, Lord, please have been with me of all the times that I didn't use rubber. then I could be, you know, having AIDS right there. You don't know until you go take one. And then every 6 months, if you've had sex in the middle of those 6 months without a rubber, you still don't know. Because they could have gave it to you right then. And so I just don't trust it. Let's always wear rubbers. Condoms, I'm sorry. Cancer is a general term to be used to describe a disease in which abnormal cells grow in an uncontrolled way. Underline that. Abnormal cells in an uncontrolled way. A tumor is a group of abnormally growing cells. A benign tumor, and know these definitions. What is a benign tumor? It's considered non-cancerous. So what is a malignant tumor? Cancerous. So you want to hear that if you have a tumor or a lump or a bump, whatever, that it is benign. That you need to jump up and thank the Lord.
She had cancerous tumor. She had cancer all in her body.
They will call them malignant. Cancer often appears in the breast, colon, rectum, uterus, prostate, lungs, skin. All those are common places. The risk factors: age, race, gender, family history, tobacco use, alcohol use, poor diet, physical activity, additives, radiation, exposure to sunlight. What happens when diagnosed early? We can treat it, we can control it, hopefully we can get rid of it. But you're going to have to get treated and checked. Some warning signs is weight loss, fever, fatigue, pain, skin changes. You'll see this stuff. Changes in bowel or bladder function. It may be in your colon. Sores that don't heal, unusual bleeding or discharge, especially breast, discharge or bleeding. Thickening of the lump in the breast, scrotum, or other parts of the body. You'll feel a lump, it feels like a marble is the couple that I felt, like a marble, and it will grow eventually. Indigestion, difficulty swallowing, it may be throat cancer. New mole or recent change, that's skin cancer. Nagging, cough, or hoarseness, that's throat also. We can treat it by surgery, chemotherapy, or radiation, or a combination of all of that. And that right there would take somebody almost out. It will mess them up, and some people would rather not have that. They would rather just die.
All three, what they got to do all
Sometimes
They
they
put
will.
that port in you for your chemo. Then I don't know how you did the radiation. I can't remember.
It's a beam of light, radiating,
And
like
it takes your
you're in the
hair out.
microwave, that spot.
So that's what take your hair
Chemo can do it too.
Chemo most of the time, and radiation.
My girl,
Surgery is
she
just
had
them
that.
taking that part and cutting it out, and then
She had-
afterwards they have chemo and radiation.
My girl, she had hair just as long as yours, and it always just coming out
Yeah.
in big balls.
It'll do it.
And
Know
then
that each cancer case is different. Cancer is a general term, but it does mean that it is a tumor that's growing uncontrollably. Treatment affects each person differently. Don't make assumptions about their condition. Residents may want to talk, they may not want to talk. Never say everything will be okay. That's one word. The
It's
words
a-
that you do
a
not say.
cliche.
That is a cliche. You do
So you
not say
cannot
it.
say everything's okay.
Nope. Because when I'm that person, that's what she said, everything was gonna be okay.
So you can say
Gave
you're
me
okay?
some kind of hope.
Or
If they ask you how they're doing,
just hang in
you know,
there.
I like just hang in
Oh my
there.
goodness, I hate that even worse.
You know,
Hang in
I don't know what's going on with you, but when the doctor comes back around or the nurse comes back around, you can ask them. I'll give it to somebody else. Me, I'm gonna give it to the doctor and let them just tell you all about it. And let them deliver the bad
my
stuff.
thing is, I always say everything will be okay.
there. Yeah,
I'm
me
gonna
too.
be
That's
calling
the
out
worst.
I tend to do
thing.
that too, but you try not to. Especially in their
You
last
just try to
days,
comfort
hospice care,
people.
things like that.
Once you're on hospice, that's not, you know, you finna get ready
Do
to
you get used to it? Being in hospice care?
No, I don't like hospice care. I don't like it, period.
'Cause every patient you're going to
know
have
is
is
gonna
going
die.
to die, like literally going
You
to
got some that are like, oh gosh, they must be, they like come back from the dead
Yeah.
and live
That's how
several
my grandma
years,
was.
but
Oh, some of them do?
some of them will come back and live several years. You ain't God, them doctors ain't God. They always say that. Yeah. Continue. Proper nutrition is important for residents with cancer. Follow the care plan exactly and carefully. Sometimes they messed up they may have to have liquid diets because their appetite is terrible. They won't eat and they can't eat. Right. Something might be wrong with them. Also, page 106, use plastic utensils for a resident receiving chemotherapy. Underline that. It's because they say they taste metal from the spoons. It said they actually taste that metal. Cancer can cause great pain, especially in the late stages. Watch for signs of pain. A lot of repositioning we're gonna do. Talk to them, music. Keep them comfortable because I've seen the pain, and pain is real, and that's what takes a lot of them out. Give them no morphine to take the pain away. Morphine also suppresses your breathing, so too much morphine is going to kill you anyway, but too much pain will too. You don't want nobody to die in pain. You want them to be comfortable and maybe possibly sleep peacefully because you gave them some morphine, and otherwise they would have been hollering and screaming until they died. You know. Yeah, I don't want to do that. That's why I don't work in hospital. Get back rubs if you can. We're going to still treat them like they're not going nowhere. We're going to change them, and we're going to move them, and we're going to reposition them every 2 hours. It doesn't matter how many, if they say they're going to die in 2 hours. We're going to come back in them 2 hours. If they're not gone, we're going to reposition them. You know, I don't care if they're going to die 10 minutes later. We're going to keep positioning them.
Even if they're dead?
No, if they're dead, we're going to call the nurse. Underline this though, this is very important. Use lotion on dry or delicate skin. Underline this though. Do not apply lotion to areas receiving radiation therapy. You do not do anything with that. They'll actually have like a square, say it's the breast, and they've radiated the breast, right? So here you go. This whole thing they'll have little lines, and in the middle, little thing, but you do not put nothing or do nothing in this area because radiation messes with the good skin too, and you don't want to add. That's a whole other chemical that you're adding to that area that could mess them up. So do not add anything to that. Help residents brush and floss their teeth regularly. Medications, nausea, vomiting, or mouth infections may cause pain and bad taste in the mouth. Commercial mouthwash sometimes we can use, but we don't want to mess up their mouth, especially if it's already messed up. People with cancer may have poor self-image. They start losing their hair. They get real weak. They do look about terrible if they're trying to do chemotherapy, and it just drains them. I mean, it looks like it takes the life out of them.
Beautiful.
But you just continue. You got to get them some hair. If they're a guy, get them a Chapt, their favorite team. Just something to encourage them. Don't intrude if they get visitors. Let them have their visitors. Having a family member with cancer can be very difficult. Be alert to the needs that's not being met.
I've never had to deal with that.
Yeah, it's pretty bad, and anybody that's passing away, and I've seen it. Even my friend, she'd call me. I've had 2 friends, and the family, their mother passed, father passed, and mother. And they would call, and they would about know that it's happening. The facility calls them and says, hey, I don't think she's got much longer. I think you should come up.
They did that to my friend.
Yep, and because they know, and especially if they're in any kind of pain, they know if they give them any pain medicine that they're probably going to die, because that's what pain medicine does. It takes away their respirations. But would you rather be in pain and die in pain, or die to ease and die peacefully?
That's how it was with my grandma. They called and said that, and then like the whole family was over there, and she literally died while everybody was.
Yeah.
Some people do that.
And they let you know, because the hospice, they didn't think, my friend's mother would go, but she gave her some medication and started breathing funny. She called the lady, she's like, well, you need to get prepared. And that's what happened.
So
All the family was
they
there.
already know it's going.
All the family, not all of it. Some of the family was there, but soon they were all on hold.
No, I'm saying like so they tell the patient like.
I would, but most of the time at that point, the patient's almost gone. You know?
Yeah, they're there, but they're not
They're
alive.
there,
They're not moving. That's how my grandma was. She wasn't moving. She was just breathing. That was it. She couldn't talk.
My grandma just.
I don't trust that. What's the last sense to leave the body?
What?
What's the last sense to leave the body?
Here.
Here.
Yeah.
I always talk to them.
I
I pretend that they're in there. I don't know that they're not, but I know their body's not working.
I know when she first passed.
I'm hoping that their body's not working as much as to feel pain.
Mhm.
But I would like to imagine that they're not feeling pain and they can hear
I
me.
still just talk to them
Yeah.
as if you were
My grandma squeezed my hand. So.
My grandma,
Oh.
she couldn't. I was still holding her hand.
Right.
Her face was like,
That's terrible.
it was so sunken in to
Yeah.
where you could see it was nothing but bone, and she couldn't move her mouth. It was just so dry.
Because
Nothing
that's what
but
happens. They
bone.
stop eating first, then they stop drinking, and then after they stop drinking, it's very downhill from there. You cannot
Yeah.
survive without drinking. And then that's what happens, they all look
Then we had to keep like
dehydrated.
It's
pillows.
like they give up, they like, they're tired of
Yeah.
suffering.
Yeah, that's how she was. I heard
Yep.
that's how she was. We had to keep pillows like between her knees, under her elbows.
That's those
and
pressure
stuff.
ulcers,
Yeah,
because she's losing a lot of her good meats too,
Yeah,
meat
she was
skin.
bone, skin, bone, that was it.
Report signs of fainting, depression, confusion, blood in the stool, change in mental status, change in skin, new lumps, sores, rashes, increase in pain, unrelieved pain, or blood in the mouth. That is your chapter 4.
Mine. That was the longest chapter of my life.
Yeah, and it involves a lot of your stuff that you need to pull back on when you're just thinking about diseases.